Dr. Emer, and we are now doing like the peachy soccer butt boost is what we're gonna call it, because he already has an amazing buttock. We're post fat grafting, and what we're doing now to get him more contour, and actually it's still really healing. Like, you can't even see yet the dimples in the back or the hourglass curve that we talk about. Squeeze in as hard as you can. You can see, relax, nice lifting. So what we're gonna do is I'm gonna focus on getting this to come a little higher using SCULPTRA. And you guys know I call this the snow globe filler because it really stimulates collagen. It's little particles that are inside a solution. Over time, once he starts working out, which is right about now, this is gonna really boost up his collagen production and help give lifting. The more of this you do, what were you saying?
The mic's on your desk still.
Oh, no, give it to me.
I left on your desk.
Oh, I wouldn't know. That's okay. The more more of it you do, the more building you're gonna get. So obviously it's the same with exercise. So we wanna exercise, and then from there, we keep building. And so you see, we push this in at different heights. The more vials you do, the more you're gonna get. So he's doing a pretty good amount. What are they saying right now?
A lot of people joining. A lot of people coming on right now. Let's see what they're saying. People are just reacting to it. They're liking what we're doing. No other questions. So how long does this last?
Well, SCULPTRA lasts permanent. It's really like 3 months, let's say, or sorry, 3 years. 3 months for us to see the collagen production. 3 years for it to keep building. Did you guys grab the microphone? Hold on a second. Can you put that right here? Great. But here's the thing. This stimulates a cascade of collagen production that just continues, and it goes on and it goes on. So you're really gonna see much more out of this with exercise and more with just proper follow-up routine. Now, I'm also doing this because we did fat grafting, and with the fat grafting into the buttock, we call that the soccer butt look. You guys can see the lift where we did. It's very natural, and the fat is now integrating, into the skin and into the muscle. And so we want to give it nutrients and give it the ability to grow and survive. And by injecting the SCULPTRA, it seeds the area and gives it more ability to grow and survive.
All right. So someone is asking, what is the recovery time for fat grafting?
I tell people 2 to 3 weeks, really, taking it easy. And then in another week or two, back to the gym. 3 or 4 weeks you're in the gym, and then you just keep working out. And from there, you really know how much of the fat grafting survives at about 3 months, which is what we just posted yesterday, one of our clients.
Okay, a lot of people are asking this. We had quite a few questions related to this. How many syringes or how many units are you doing for this result?
Remember, there's no units with SCULPTRA. And again, this isn't for a result. This is for a boost. This is the soccer butt boost. So we're doing 8 vials today. And I think it's just good. You just keep building from there. Most guys that do the fat grafting, I have them do 4 per side every few months while they're healing. Squeeze again as hard as you can.
So can we do this on the pecs, or what other areas can we do this?
On the pecs? Yes. It doesn't work as good on the pecs. I like Renuva there. You could do Renuva injections on the pecs. We'll actually combine it with the SCULPTRA. Gives a nice result. Smaller areas like the deltoid do better with Bellafill injections. Bigger areas like this, where you really can do a lot of with the muscle, with the squatting and everything like that, does really well. The more of this you do, the better. I have clients that come in a couple times a year and do 20, 30 syringes just to stay boosted. Really to get that soccer butt lift. And here's the thing, this is now going to enhance everything he's already been doing that we did for the gym, that we did in surgery, and then now that he's going to do in the gym. This isn't all from surgery, you guys. He works out hard. Now what we've done is we have just made it better for him. It's a new canvas for him to be able to build upon.
Can you build the butt with SCULPTRA, or is fat grafting necessary?
You can do both, but fat is going to give you more, which is why we did fat for him to start. Squeeze again.
Is our patient in pain?
No, I mean, relax. It's little pinches, you guys. The other thing too is this is great for cellulite. Most guys don't really have cellulite, but if they did, this a lot of women. This is why we do Sculptra. It builds in here, and then again, remember the fat is integrating right now. It needs blood supply to survive. So here we are injecting the Sculptra as almost like a nutrient to supply. You know, I used to even combine this with PRP and stem cells as well. It just, everything adds up, you know, it gets expensive. So let's just try at least the best that we can get for him now with boosting. You can see, go ahead and squeeze again. Great, so now we have a nice roundness here, relax. And I'm trying to give him a little bit so that when
Can he sit on this right after?
you can, there's nothing you really need to do for this Sculptra. I actually tell people just to start working out. We could do something called True Sculpt Flex, which can actually help boost the Sculptra. It activates the buttock muscles. Good. Anything else? Other side? So that's done on this side, so we're gonna let that settle in. You guys will see it looks a little hard right now. Squeeze again. Okay, relax, perfect. Little pinch. So now we're gonna start to identify the area on the other side that we now wanna boost. You know, some people call this a booty boost. You can call it whatever you want. We've been doing Sculptra for many years. I was actually doing this years ago, over 15 years ago, in patients that had HIV. We were trying to give them volume. Other doctors were doing silicone, which is a little high risk for a large volume area, a little pinch. And so we were doing the Sculptra. It's just pricey, but it works in the right capacity.
So I said, why do you have him squeeze and relax?
So that I can see the muscles and do the right shaping. You always want to look at someone in active and passive movement. Squeeze again, relax, perfect. So then we could see the height, where we really want to build, how we want to shape it, etc. Remember, it's always going to look a little bigger now because it's the solution has the particles dissolved inside. So you can see inside all those little particles. Those are what are going to go in. Go ahead and squeeze. Relax. Perfect. And those are going to seed the area like a fertilizer.
How are you able to tell if it's even on both sides?
Years of experience. Years of experience, you guys. Squeeze again. Relax. So this is a treatment a lot of people are doing now. I have fitness models and athletes that just do this to just boost their workouts. So I'll have people that do this, let's say 2 or 4 aside every quarter, just to keep everything looking good. A lot of women will do it on their posterior thighs for cellulite. That's what we do is we massage. Perfect. Squeeze again. Good, relax. Perfect, little pinch. This middle area is a little more sensitive. I'm going deep so that we can get in the area that the fat it was injected as well. And the only other thing I tell people is sometimes people get some bruising from this. So we usually recommend some brightening cream. I personally like Vivacia, which is a foam, and then we use it with the Isden body lotion called Uridin. You can get those at mroscosmetics.com, but you can also email us because we can give you a protocol. I have a lot of women that do injections to the buttock and get these very dark spots. He is very light skin tone, so the chance for that is minimal. Squeeze again.
Are there any chances of nerve damage from these injections?
No, the nerves are so deep here, if you know the anatomy. We're way above nerves. People who even do injectable medications go deeper than this. Almost there. Squeeze again. Relax. Perfect. So I like to give a little bit more at the height. We call this the cap. So we can get a nice lift at the top. And then in the old days, we used to do a lot of massaging. I still tell people to do it. So he would massage this area like this over the next few days, 5 minutes, a few times a day.
Are there any chances of accidentally hitting blood vessels?
No, not really. Not at this depth. Yeah, I mean, maybe a vein and get a little bruising. Good. Squeeze again. Great. Remember, this is not a filler, so yeah, it will look like there's volume right now, but that's going to go down. The particles are going to seed the area, and then we will see it boost up over the next few months when he works out. Squeeze again. Relax. Yeah, SCULPTRA is a huge thing in this area. We love doing SCULPTRA because it really helps everything you're doing in the gym. My patients love it. Last one. Squeeze again as hard as you can. Good, relax.
Our patient has been numbed before this procedure, guys. Those are asking, and he is awake.
Yeah, we do topical numbing for this. Now we're gonna clean. And then really what I do is the best part right now is we have our medical assistant do massage. And then you get a little butt massage. That's the best part. So, and then I always require whoever's taking care of the client, they have to do a butt massage later tonight. But that's it. And then you guys could see the whitening effect there is where all the particles are going in. That's numbing medicine that's inside, and we just lightly massage it in, and it seeds the area, and we're gonna see it grow and build as he works out. And this is it, everything is perfect. So now squeeze as hard as you can so we can see. Good. So now we know where we can get in terms of results. And you could do a little pan and take a look, but the goal is to have a nice sort of lift, and when you press in, you could see the density mainly in this midline into upper portion. It's perfect. All right, you guys, that's SCULPTRA for male buttock augmentation, the soccer butt boost. Go ahead and take a look. You did it. Do red lights and massage. All right, just a light massage. You did great. Oh, wait,